Have you ever popped a pill and just wondered, what actually happens next? Well, today we're going on that exact journey. We're going to follow that pill through the body to really get the science that controls its every move. So let's dive in.
Really think about that for a second. When you take something, anything, how did someone figure out that that specific amount is exactly what your body needs? It feels a bit like magic, but I promise you, it's not guesswork. It's a really precise science that maps out the entire life of a drug inside you. To get this, we need to know two key terms: pharmacokinetics and pharmacodynamics, PK and PD for short. Now, here's a super simple way to keep them straight. Pharmacokinetics, the PK part, is what your body does to the drug. Think of it as the journey. Pharmacodynamics, PD, is what the drug does to your body. That's the destination, the actual effect. For this explainer, we are all about the journey. Pharmacokinetics.
So every journey has a beginning, and for a pill, that's the launch sequence, getting the drug into your system so it can actually start to do its job. This first step is, you guessed it, absolutely critical. A drug's life inside you has four main stages, and there's a handy acronym for it: ADME. First is absorption, which is basically getting into the bloodstream. Then distribution, where your circulatory system acts like a highway, carrying it all over. After that comes metabolism, where the body, mostly the liver, starts to change the drug chemically. And finally, excretion, which is, well, getting it out of your system. And right away, we hit a super important concept: bioavailability. You might think if you swallow a 100 milligram pill, all 100 milligrams go to work. But nope, that's almost never the case. Bioavailability tells us what fraction of that pill actually makes it into your bloodstream ready for action. When you swallow a pill, it has to survive your stomach acid, then it goes straight to the liver. And your liver is like this hyper-efficient processing plant. It metabolizes a chunk of the drug before it even gets a chance to go anywhere else. This is called the first pass effect, and it's why the bioavailability of a pill is pretty much always less than 100%. It's also why an IV dose, which goes straight into the vein, is way smaller than a pill of the same drug. Okay, so the drug is in the bloodstream. How do scientists actually keep track of it? They can't follow one tiny molecule around, right? So instead, they measure its concentration in the blood over time. It's like creating a map of the drug's impact. And it makes a lot of sense when you think about it. You take the pill, the drug level in your blood goes up, up, up as it's absorbed, it hits a peak, and then it starts to fall as your body's cleanup crew, your metabolism and excretion systems get to work. This rise and fall creates a curve on a graph, and that curve tells us a whole story. So how do we read that story? Well, scientists calculate something called the area under the curve, or AUC. Now, this isn't just about how high the drug concentration gets at its peak, it's a measurement of the total exposure your body gets over time. It's probably the single most important number for understanding a drug's overall effect. And why is this one number so important? Well, first off, it's the gold standard for approving generic drugs. For a generic to be considered the same as the brand name, its AUC has to be nearly identical. It proves you're getting the same total dose. It's also essential for drugs with a really narrow therapeutic window, where the line between helpful and harmful is razor thin. Take an antibiotic like gentamicin. It can be tough on the kidneys. So doctors use AUC to make sure the dose is high enough to kill the infection, but low enough to keep you safe. Okay, so after the drug gets absorbed, it's got to travel around the body and then eventually get cleaned out. And this brings us to our next two big ideas: distribution and clearance. The volume of distribution, or VD, sounds a little out there, I know. But the best way to think about it is with a little analogy. Imagine your entire bloodstream is a flask of water. Some drugs love water, and they're happy to just stay in the flask. They have a low volume of distribution. But other drugs are fat-soluble, and they spread out everywhere, into all your body's tissues. It's like they were poured into a much, much bigger container. Those drugs have a high VD. It's not a real volume, but a theoretical one that tells us just how far and wide a drug likes to roam. Now, if the volume of distribution is the size of the flask, then clearance is basically the size of the leak in that flask. It's a measure of how good your body is at removing the drug. It's usually talked about in volume per time, like liters per hour. It literally represents the volume of blood that gets totally scrubbed clean of the drug every single hour by your liver and kidneys. So how does this play out in real life? Let's put these two ideas together. The volume of distribution, how big that flask is, helps doctors figure out the loading dose. That's that big first dose you might get to quickly fill up the flask and get the drug level up to where it needs to be fast. Then, the clearance, the leak, helps them calculate the maintenance dose. Those are the smaller, regular doses you take to replace exactly what's being cleared out, keeping the drug level nice and steady. This all leads us to a term you've probably heard before, half-life. It's one of the most practical things to know about a drug because it directly tells you how often you need to take it. The definition is actually beautifully simple. The biological half-life is just the amount of time it takes for your body to get rid of exactly half of the drug that's currently in your system. That's it. If a drug's half-life is 12 hours, then 12 hours from now, half of it will be gone. Let's just look at this timeline. For a drug with a 12-hour half-life, you start at 100%. After 12 hours, you're down to 50%. After another 12 hours, so 24 hours total, you're at half of that, which is 25%. After 36 hours, you're at 12.5%. And you see how it goes. It's a curve, not a straight line down. Now, here's a fantastic rule of thumb. It takes about 5 half-lives for a drug that you're taking regularly to reach what's called a steady state. That's the point where the amount of drug you're taking in is equal to the amount your body is clearing out. This is exactly why some medicines, like certain antidepressants, can take weeks to really kick in. If a drug has a half-life of 4 days, it's going to take around 20 days to build up to a stable, effective level in your body. And this table just perfectly illustrates how wildly different drugs can be. I mean, look at this. Adenosine, which is used for heart emergencies, is gone in less than 10 seconds. Morphine is gone in a few hours. Diazepam or Valium can hang around for a couple of days. Fluoxetine or Prozac has a half-life of almost a week. And then you have something like the heart medication amiodarone, which can have a half-life of over 100 days. It's just incredible. And this huge variation is exactly why dosing schedules are all over the map. So, let's bring all this amazing science back home, back to your own medicine cabinet. How does all this come together to make sure the medicine you take actually works safely and does what it's supposed to do? All right, so most drugs get cleared out of your system using what's called first-order kinetics. The analogy here is perfect. Think of it like a whole team of athletes signing photos. The bigger the pile of photos, the more they can sign at once. The more drug there is, the faster your body clears it. But a few substances, and alcohol is the famous example, follow zero-order kinetics. Here, the system just gets saturated. It can only work at one constant speed. This is like having a single athlete who can only sign so fast, no matter how massive the pile of photos gets. And that saturation is why high concentrations of these things can be so dangerous. Your body just can't clear them any faster. So, to wrap up the key points of our journey, pharmacokinetics is simply the story of ADME: absorption, distribution, metabolism, and excretion. The area under the curve, or AUC, is that crucial measure of total exposure, and it's key for approving generics. The loading and maintenance doses get you to the right level and keep you there. And finally, the half-life is the clock that sets your dosing schedule. You know, almost 500 years ago, a physician named Paracelsus said only the dose makes the poison. He knew that basically anything, even water, can be toxic if you have the wrong amount. Pharmacokinetics is the modern science that lets us master that dose. It's how we turn potentially powerful substances into precise, life-saving medicines.